Patients informed written voluntary consent for the provision of medical services. This voluntary consent is drawn up in accordance with the Code of the Republic of Kazakhstan on public health and healthcare system. I give my consent to the medical personnel of ASTANA VISION eye clinic networks for performance of the following types of medical services. Diagnostic examination, which includes the necessary amount of measurements of anatomical parameters of visual organ, physical parameters, functional indicators, followed by a consultation with a physician, and determination of the treatment assessment for reliable diagnosis strategy. I have been informed that during the diagnostic examination, I may be injected with mydriatic eye drops, which will temporarily reduce my visual acuity and make it temporarily impossible to drive vehicles. I have been informed that the examination, together with a consultation with a physician, takes 1.5 to 2 hours. I have been informed that if I have anisometropia, refresh difference between the eyes, of more than 1.5 dp in the spherical component, and/or astigmatism of more than 1.5 dp, the selection of glasses and contact lenses is carried out on a fee basis. Any selection of glasses, including complex glasses, for a fee can be carried out only after the end of the effective medical mydriasis, pupil dilation, at a time agreed with the clinic and no later than 1 month after the initial diagnosis. I am aware that I shall inform my physician of any health problems, allergies or individual intolerance to medicines or diagnostics, or use of alcohol or drugs before starting any diagnostic procedures. I also agree not to change the prescribed treatment plan without the approval of the attending or on-call physician. It has been explained to me, and I am aware, that certain contact examination techniques may result in temporary reversible corneal and conjunctival tissue damage with temporary disability after the diagnosis is completed. I am aware of the contents of the above medical actions, associated risks, as well as possible complications and consequences, including temporary disability. I am aware that the instruments used in the examination have technological limits to the measurement accuracy, which can sometimes lead to errors in determining the parameters of visual organs. I have been informed that there are other medical facilities where I can receive medical treatment for my visual impairment and about alternative methods of treatment. I am also aware of possible risks and complications of ophthalmic treatment and benefits that may result from this type of medical intervention. By signing this document and paying the cost of services at the cash desk, I agree with the provision of identifying information and the processing of my personal data. It is explained to me that I will have the opportunity to ask the physician questions about my disease, the proposed medical intervention, and possible complications thereafter. I am informed that, under this agreement, within the validity period of the examination, from the date of the initial examination, I am entitled to 1 additional free consultation if I have questions about the prescribed treatment. The diagnostic results are valid from 1 to 3 months and are indicated in the patient's discharge. I am aware and agree with the terms and conditions of the contract for the provision of paid medical services by ASTANA VISION eye clinic networks. By signing this consent, I confirm that I am not limited in capacity. I do not suffer from diseases which can impede understanding of this consent. I also state that I am not in delusion, deceit, violation, threat, malicious agreement, or concurrence of severe circumstances. I have read, fully understand, and agree with the contents of this document. In witness whereof I set my hand upon this document.